Respiratory 102. The IPPB. IPPB, or the intermittent positive pressure breathing, is pneumatically driven. It is primarily for IPPB therapy, not ventilation. It is for short-term therapy of inspiratory positive pressure to a patient that can spontaneously breathe. And it delivers a slow, deep, sustained inspiration by a mechanical device that provides a controlled positive pressure breath. The physiologic effects are increased mean airway pressure and tidal volume, decreased work of breathing, and it is usually slower at about 6 to 8 breaths per minute. And it can alter the I to E ratio. Indications are to improve lung expansion, which is mainly for atelectasis and patients unable to do the IS or CPT. Also for the inability to clear secretions. The IPPB will promote coughing. Also as an alternative to intubation, where it can provide short-term non-invasive ventilation with a mask. And lastly, to deliver medication, if the patient is unable to do them with a nebulizer or MDI. Contraindications are untreated tension pneumothorax, intracranial pressure greater than 15 mm of mercury, often in neuro patients, hemodynamic instability that could be affecting the heart rate and blood pressure, recent facial, oral, or skull surgery, tracheoesophageal fistula in which the trachea and esophagus are connected, recent esophageal surgery, active hemoptysis from a possible rupture, nausea, air swallowing, active untreated TB, hiccups, or evidence of blebs, which are air sacs in lung tissue only seen on X-rays and can cause pneumothorax. Hazards are increased airway resistance and work of breathing, pneumothorax, hemoptysis, hyperoxia, which happens mainly in COPD patients because it is hooked up to direct O2, gastric distension, impaction of secretions, hypoventilation or hyperventilation because it instructs the respiratory rate, and also auto-PEEP or air trapping because there is not enough time to exhale. Things to be monitoring are breath sounds, pulse, sputum production, and the patient's subjective response. The bird mark 7 can be time, pressure, or manually triggered during IPPB therapy. Pressure or time cycle during use as a ventilator. Patient triggered. And pressure limited. The bird mark 7 controls include pressure control, flow rate, sensitivity, which when set the patient should have at least a -1 or -2 breath to trigger it, red toggle, which is the manual trigger, air dilution, which changes the saturation where you push in for 100% or pull out for 40 to 60%. Apnea, or the expiratory timer, is only for while being used as a ventilator to determine the respiratory rate. Some troubleshooting ideas are: if there is loose pressure, check for a leak. Too much pressure, check the flow. It will not cycle into inspiration, then check the sensitivity. It will not cycle off, then check for a leak. Pressure not rising normally, then increase the flow. Too much negative pressure, then check the sensitivity. And if the machine auto-triggers, it is probably set too sensitive. Hopefully we don't need to know this picture, but should probably look it over anyway. See you tomorrow, suckers. Respiratory 1.